नमस्कार। मैं हूं प्राध्यापक डॉक्टर राजेंद्र रघुवीर देशपांडे फ्रॉम पुणे, महाराष्ट्र स्टेट, इंडिया। आई एम एमडी इन आयुर्वेदिक मेडिसिन एंड एमडी इन आयुर्वेदिक फिजियोलॉजी। मैं इस श्लोक श्रृंखला में आप सबका हार्दिक स्वागत करता हूं मेरे आयुर्वेद एकेडमी चैनल में। ये जो श्लोक के डिस्कशंस चल रहे हैं वो काय चिकित्सा के लिए बहुत उपयुक्त है। फिलहाल दीज आर श्लोक्स वेरी इंपॉर्टेंट फॉर द मेडिकल स्टूडेंट्स, आयुर्वेदिक स्टूडेंट्स, for the Ayurvedic practitioners as well, and of course the Ayurvedic professors. So each and every shloka is with Sandhi Vigraha, and also I am putting some inputs and little tips in between the shloka reading and recitation. So let us start with Ama Dosha Chikitsa Sutra. So the important thing before the Panchakarma, there should be Ama Pachana. As we have already seen in the previous, there are 5 videos already we have covered, and now this is the 6th video. And you will very much fascinated to see that these videos are having the number, say for example, 30, 40, 50 videos will be there, because each video I am making a little bit short to understand the shlokas properly. Okay. So what I mean to say, there are panchakarmas, Vamana, Virechana, Basti, Rakta, Moksha, and Nasya. But Ayurvedic advice is that when doshas are prakupit, they may be samadosha or the niramadosha. When they are niramadosha, it is very easy to remove them out when they are too much prakupita or the vitiated. But when they are with the ama, and what is exactly the ama? Ama is like a toxin created in the body because of the faulty digestive fire or the agni or faulty metabolic processes in the body. Okay, so this ama is endogenous type of toxin, and if the bacteria, some viruses, fungi, they attack from the outside, these particular things, microorganisms, when they create some toxins, that is also called as ama, but that is exogenous type of toxin. So their ama can be from the inside as well as from the outside. Okay. So if any dosha or any dhatu is afflicted with ama, first you try to digest the ama. So that is called as a Dipana Pachana Chikitsa, which is very important before you do the Panchakarma. So best Dipana Pachana, as you know, the Nagarmotha is the best drug for the Pachana, Sarvasreshta Dravya Agrasangraha. Then there is a Trikatu, Suntha Maricha and Pippali, Trikatu tablet. Dhanavati is also available. This type of the Panchakola, so Jirakadhyarishta, all these things can digest, can appetizers, and can also be the carminatives. Okay. So what will happen if by chance, by mistake, if anybody neglect those ama and try to remove the ama, then that will destruct where they have these doshas are attached with the ama, with the dhatus. And that particular amalgamation, that union, that will be broken, that molecular structure of the dhatus or the tissues. So if you want to take care of the dhatus or the tissues, then you must first digest the ama, and then Purva Karma, Snehana and Svedana, and then only you can do the Panchakarma. This is the nutshell or the essence of this shloka. Sarva Deha Pravisrutan Saman Doshan Na Nirharet. When the doshas are sama, don't take them out. Linan, how they are sitting? Linan Hatushu Alkrishta Falat Amat Rasaniva. Like a mango juice. All the fibers of mango are attached to that internal seed. So that when we try to sketch that stringes of then automatically that original structure of that substance is destroyed. So falat amat rasan eva ashreyasihi nashaya te syu durnirhatvat. If you badly take them out, that will they will destroy the ashraya, that is dhatus. They will destroy the structure of the and function of the dhatus. That samadosha. Pachanahi, dipanahi, snehi. That means you should take tan svedahi cha parishkrutam. This should be the steps before the panchakarma. First dipana, then pachana, then snehana, and then svedana. Snehana is a lubrication, svedana is a fermentation. Shodhayet shodhani kali. When there is a proper time of shodhana, for example, kapha prakupita is dosha, sinusitis problem, asthmatic problem, vamana is given in the vasanta rutu, spring season. Then Basti is given for the musculoskeletal problem or the neurological problems in the Varsha Rutu. That is a Prakupita Avastha of Vata dosha. And the Sharad Rutu, autumn season, is a Pitta Prakopa. So naturally, Virechana is advised, Rakta Mokshan is advised in the Sharad Rutu. So Yatha Kali and Yatha Sannam, Yatha Balam, as per considering the dosha strength, Prakupita dosha strength, virulence capacity, and as well as the capacity of the patient. Considering all these factors, you should perform the Panchakarma. Next, we will go Amadosha Chikitsa Sutra. This is a continuation. Hanti Ashu Yuktam Vaktrena Dravyam Amashayan Balam. When the doshas are more accumulated in the upward part of the body, like amasya or the stomach, then you should take them from the upside, like a vamana. Therapeutic vomiting is advocated when the doshas are on the upper side. Sagrhanena cha urdhva pakva. So here, when the doshas are on the upper side, even the urdhva jatru is a clavicle. The ENT, ear, nose, throat problems, ophthalmic problem, brain problems. Then many times this upward type of the purification, like with the Vamana or the Nasya, is useful. And then Pakva Dhanat Gude nature. That means if the doshas are on the lower side, on the Pakvashaya, large intestine, small intestine, especially the large intestine, Pakvashaya, then you have to remove by the Virechana or the Basti. So that is the treatment on the downwards passage. Utklishtan urdhvam va nacha aman vahata swayam. धारियेत औषधैः दोषान् विधृताः ते हि रोगदाः प्रवृत्तान् प्रागतो दोषान् उपेक्षित हिताशिनः. When the doshas are too much prakupita and they want to come out of their own, for example, if the patient is getting cough, if the patient is getting little bit sneezing, so that can be a protective mechanism of your body. If you have the little bit loose motions in the morning 1 or 2 times, don't get excited or the panic. Oh, I'm having the loose motions, bacterial diarrhea, nothing like that. Whenever there is a toxin in your body, that is a natural human nature that the doshas or the waste or the toxins, they try to take body out. So first you upeksha hitashin. Upeksha is that means don't bother about that automatic passing of the waste product or the toxin. Okay, hitashin. Vibadhan pachanehi taihi pachayet niraretva. When the doshas are very compact, vibandhan, then you have to digest them. Carminatives should be used, and then pachana, dipana pachana, and then you have to remove it. Next is Avarana Chikitsa Sutra. Avarana is a covering, but one dosha can cover to the other dosha, or even Pran can cover the Udan can cover the Saman and something like that. So Avarana is a type of the Srotorodh, is obstructive type of pathology. So we have to we have to consider two things: who is covering, who is obstructing, and which dosha has been obstructed. So these two things you have to consider together, and you have to do the treatment. Kriya sadharani sarva sansrutte cha apishasyate vate pittadivi srotah so avruteshu visheshtaha charakchikitsa sthan. Okay. Next, pitta vata. Pitta dosha is covering the vata activity. Pittavrute visheshena shitam ushnam yathakrayam vyatyasat karayat. When pitta is covering the vata dosha and obstructing the signals or the cell membrane transport, then Ayurveda is advising that Shita and Ushna, this type of the regimen should be used in the alternate method, because Pitta can be controlled by Shita and Vata can be controlled by Ushna. So Shita Ushna Kriya in Vyatyasa, like alternative. And there Sarpi is a ghee, medicated ghee, is the best treatment for Pitta dosha, Jivanyam cha Shasyate. The substances that you can use is a madhu, that is honey, yashti madhu, glycyrrhiza glabra, licorice, bala tailen. These all the things you can use. Oil, bala siddha taila, ghita kshiraihi. Also you can use the medicated ghee and medicated milk also, just sechanam. Okay, next. Kapha vrutavad. In spite of the pitta, it is a kapha is obstructing to the vata. So kapha is a very strong in the composition and the compactness. Snigdha, shita, guru, etc. These are the properties of kapha dosha. Kapha vrute yavannani. Yava is the best treatment for kapha dosha, because yava is always, barley is light in nature, and that is antagonistic to the kapha properties. Jangala, this is the meat from the animal who are staying in the forest. That is more useful. Mruga pakshina, mruga, deer. Okay. Also, there is a kapha obstruction is there. So naturally, you have to use these vasodilators like fermentation treatment. That will remove the avarana of kapha. Okay. Tikshna niruha. You should use the very strong type of the niruha basti, decoction enema. Vamanam, savirachanam. So you can give also Vaman and Virechan, because Kapha is a very morbid type of the pathology, and it is hard to remove that pathology with the Kapha dosha. Of course not the normal Kapha, is a pathological Kapha. Okay, Jirnaha sarpihi. That means what? Whenever you use the ghee, it should be old one, 1 year old, 10-year old, something like that. Then tatha tailam tila sarshapa sarshapajamidam. Sarshap is also most essential commodity for treating the kapha dosha. Then kapha pitta avruta pitta. Okay, sansrushta kapha pitta bhyam. When the two doshas are obstructing, then that is called sansrushta. And when all the three doshas are coming together and making pathology, that is sannipata. Sansrushta and sannipata. Pittam adu vinirjayat. When there is a compound pathology, then first you treat the pitta dosha, because pitta is a little bit more hot and aggressive and very acute in the starting some serious complications. So always take care of the pitta first, and then you can follow the management of kapha also. Then amashayagata vata chikitsa. Amashaya, upward part, stomach region. Amashayagatam gatva kapham vamanam acharit. When there is a kapha accumulation in the upward part, you have to use the vamana. Pakvashe virekam. To pitte sarvatra tatha. Whenever there is a pitta problem, pitta pathology, and at the lower abdomen, then you can use the virechan type of chikitsa. Also, if the doshas are pitta is all over the body, then you can use the virechan chikitsa. Okay. Svedaihi vishanditaha shleshma. Shleshma is a cough. Shleshma can be make a diluted or the liquefied with while using the svedana treatment, fermentation treatment. Yada pakvashe stitaha पित्तम व दर्शयत लिंगम बस्ती भी ही तौ विनिधरेत. श्लेष्मणा अनुगतम वातम उष्णैहि गोमूत्र संयुतैहि. So when the shleshma and vata, they are together. Shleshma is also shita in a property, cold in property, and vata dosha is also shita. So double. So shita square. More type of the what you call congestion is there, obstruction is there. So there you have to use the antagonistic to the opposite to the shita guna, that is ushna guna. And gomutra is also having the ushna guna, cow's urine, that we have to use together. Okay. Niruhi pitta sansrishtam nirharet shira sanyute. When pitta is there, pitta sansrishta, pitta joining to the this kapha pathology, then you have to use the kshira, medicated ghee also. Next, annavruta vata. This is very easy to understand. The excessive eating is always troublesome for our stomach. When we go to the any functions like a marriage ceremony and all this ceremony, we eat a lot in the lunch, and then we don't want to eat anything in the evening, because our all the vata activities are obstructed because of the excessive eating, annavruta vata. So patient cannot belch, patient cannot pass the flatus, and he is full of stomach. So that is annavruta vata. All our energy has been also obstructed. So there, of course, I have mentioned about annavruta vata, which we will talk about next. But here in the, sorry, we are starting with the different elements are obstructing the vata dosha. For example, raktavruta vata. Annavruta vata is also there. I am sorry, I read this annavruta vata. This is not annavruta, but it is avruta vata. Avruta vata, one of the type is annavruta vata. Okay, that we will discuss in next 2 slides. Raktavruta vata. Shonitena avrute kuryat. When the pathological septic infected anything is obstructing the vata pathology, then you should do the vata shonita ki kriya. Vata shonita, vata rakta. You have to treat them as a vata rakta type of the management. Like for example, virechan rakta mokshan chikitsa is very good for this raktavruta vata. Okay. Then amavruta vata. Amavruta. When there is a lot of ama is there, faulty metabolic processes in the body. So when this dyslipidemia type of the complaints, then diabetes mellitus, this is of all the diseases metabolic disorders. So whenever these metabolic disorders there, they also obstruct or interfere with the vata activities. It may be the physical activity, it may be chemical activity, it may be neurotransmitter activity. So obstruction is always there with the ama. So the diseases are like, then you have to treat them like a patient is having like a prameha, urinary disorders. Prakarshena mehati iti prameha. Madhumeha is related to diabetes mellitus. Then vata, medagni, that means also medorog treatment. Then Amavata treatment, that all the treatments you can do when there is Amavrita Vata. Next, Mamsavrita Vata. Now, mouse pathological state of the muscles, mouse dhatu, they are also hindering the activity of the musculoskeletal system, that is Vata. So here the mouse is a Parthiva, like similar to the Kapha dosha. So here also Guru is there. So Guru, to reduce that heaviness, you have to use the Svedana. Svedana is a fermentation, vasodilatation, and more Srotorod is being removed by the Svedana. Then you have to do the Abhyanga. Abhyanga is the best treatment to make the Vatanulomana. Then Rasakshira Sneha Mamsavrute Mataha. Next is the Asti Majjavrita Vata. Then Vata dosha is obstructed at the level of Asti and Majja. That means more deeper type of the tissues like bones and bone marrow and nervous tissue and the brain. All these are components which can be considered as Asti Majja, and they are obstructing the Vata activity. So here you have to use the Mahasneha, Ghrita Taila Vasa Majja. Ghrita is a ghee, medicated ghee, internally especially. Then you have to use the tail, that is externally, like for example, Dhanvantaram, Kujambu, or the Ashwagandha tail, etc. And Narayana tail, Mahanarayana tail. Then also Vasa. Vasa, you have to just bring the meat from the market and then just cook it. Some oil layer is coming up. So that oil, take it out, filter it, and that can be considered as a Vasa. And I have personally used that Vasa for the Abhyanga, especially the local Abhyanga, Sthanik massage, especially the muscular atrophy type of the problem. When nerve conduction is not proper, that particular muscle becomes atrophic if the nerve conduction is hampered. So there, Mahasneha, especially Vasa, is very useful. Shukravata Vata. Again, the pathology in the Shukra dosha, and that is obstructing to your all the spermatogenesis process, and infertility type of the problems also starts. So Puravat Retasa Avrutte. So it's very similar to the consideration of the Shukra Dhatu's different, what you can say, the elements. Here, Annavritavat, which I had talked 2 slides before. Annavritavat, I have already explained. Annavriteta Tullekha Pachanam Deepanam Lagu. Very simple. You have to use the appetizers, then carminatives. That all the things will take care of the excessive accumulation of Vata in the stomach. Then Malamutra Svedavruta. These also, waste products also can hinder or obstruct the activity of Vata dosha. Okay, Vata Mutralanitu Mutraste Svedaha cha Uttrabasteya. Especially when urinary problems are there, then Ayurveda has recommended a special type of the Basti, which is called the Uttarabasti. Uttarabasti in the males, that can be given through the penis, and in the females sometimes when there is a menstrual problems or some type of leukorrhea or all these things, even the infertility problem, you can give the Basti catheter. With the catheter, you can give it the vagina. That means the female reproductive genital organs you can give to the योनि मार्ग के द्वारा जो दिया जाता है उसको उत्तरवस्ती बोलते हैं. So in vaginal, through intravaginal, you can give some medicated ghee or even the oils. For example, cassis oil or the kshara oil that we use to remove the blockages from the tubes, fallopian tubes. So when the infertility is because of the tubal block, don't forget this use of the cassis tail or the kshira tail, kshara tail. I'm sorry, not kshira. I'm sorry, kshara tail for giving the uttarabasti. And then of course afterwards you can use the phalagrita as well for the uttarabasti. Next is the Shakruta. Shakruta is a purish, that is a stool part. Okay, Tailam, then you have to use the Eranda Taila, castor oil. Snigdha Udavartavat Kriya. So naturally, Udavarta is a disease when there is anti-peristaltic movements, when there is a obstruction in the lower abdomen or any part of the GI tract, the peristalsis movements on the reverse side, Pratiloma Gati of the Vayu, that is called Udavarta. Okay, so there you have to use the Anulomana Chikitsa. Then Vayu Sarva Avarana Chikitsa. For example, Udanam Yojayat Urdhvam. When there is obstruction to the Udana Vayu, you have to take the treatments, modalities, which will make Anulomana Gati of Vata dosha in the upward direction. Apanam cha Anulome. Apan is from the lower type of the treatment management, like Basti or Uttara Basti or something like that. Then Samanam Shamayat. You have to control the Samana Vayu with given Shamana Chikitsa. In between the meal, you have to give the, for example, Hingvashtak Churna, Trikatu Churna. In between the meals, that will control the Samana Vayu. Then Tridha Vyanam tu Yojayet. All this, Urdhva, Anuloman and Shamayet, all these treatments can be together, can be given for Vyana Vayu problems like heart diseases. Prano Raksham Chaturubhyaha api sthane hi asya sthiti dhruva. Pranavayu is in the major places in the brain. So one must control powerfully or very immediately or very promptly treatments are given for controlling the pranavayu aurtatva. Swasthanam gamayet evam vrittan etan vimargan. Basically, because of the Sruturod, the channels are, that means the whatever the conduction is going on, diversified. And that diversity, that is called as diversification, is called the Vimargadamana. But we want to make them in the track. Okay. So, my dear friends, I think this is all that I wanted to try today in the sixth part of the Shloka recitation and discussion. I hope that you are liking this video. Please share it and don't forget to subscribe my YouTube channel, because there are videos for everybody, for students, professors, doctors, and teachers, and also for the patients. Okay, so I wish all the best, and we will see you in the next video. Take care, and thank you very much.